Good afternoon, everyone. Thank you so much for joining us for the Starting a Family Open Enrollment webinar. We have a great program lined up for you to really go into a deeper dive about your benefits when it comes to starting a family. I'm just here. My name is Jessica Shee. I'm the Director of Communications at the Health Service System, and I just want to give you a quick overview. Everyone will be on mute for the entire presentation. However, we highly encourage and would love for you to share your questions with us. So depending on whether you're joining from a computer or if you're joining from a mobile tablet or cell phone, your what do you call that, bar will be either on the top or on the bottom of the screen. And please, if you find that little question mark bubble, please hit that bubble and you can type your questions to us there. And if some of you may have more complex questions or personal questions, we highly recommend that you schedule a one-on-one consultation with our vendors, or if it's for a health service system question, please contact us. Our member services are happy to help you. Brian, we're ready for the presentation. Thanks so much. Oops, Brian, you're muted. Oh, Brian, we need the sound.
Pardon me, one moment. I'm sorry.
Starting a family can be a daunting task. With so many moving parts and variables to manage, the last thing you should be worried about is navigating your health benefits. That's where we come in. Hello, my name is Michael, and I'm one of 25 benefit analysts at the San Francisco Health Service System. I'm available to answer questions you may have about health insurance benefits you or your family are eligible for as an employee or retiree of the City and County of San Francisco, Superior Court, City College, or Unified School District. I can assist you in getting your new family members enrolled onto your existing or newly established health plans, advise you on any premium changes, and even help choose baby names. All kidding aside, though, we at SFHSS just want to make sure you are aware and knowledgeable about all your options. Most people don't know and are very happy to find out that our health plans include several benefits that they didn't know we offer, such as surrogacy benefits, adoption reimbursement, or infertility coverage. These are just a few items that are included in our SFHSS health plans. Thank you for attending our webinar today, and we hope this helps you understand your benefits as you consider starting a family.
Hi, my name is Maya Smith, and I am a program manager from Canopy Health Network. Today, I will be walking you through everything you need to know when starting a family. In today's agenda, we will be covering Canopy Health Network, starting a family, preparing for pregnancy and choosing an OB, making a birth plan and fertility benefits, preparing mothers and families for healthy births, providers in our network, childbirth classes, postpartum visits and choosing your pediatrician, gym discounts, My Canopy Health app and portal, our partners in starting a family, and lastly, Alliance Referral Program. In January 2021, HealthNet launched Canopy Care HMO, a product that exclusively utilizes the Canopy Health Network. This new health plan features the providers that have been serving our communities for decades. Starting a family can be one of the most exciting events in your life. Our goal is to help women and their babies stay safe and healthy, and to prepare families for the many changes that lie ahead. Preparing for pregnancy and choosing an obstetrician. If you are planning to have a baby or thinking about it, there are steps to take to give you and your baby a healthy start. You may schedule an appointment with any available obstetrician within the Canopy Health Network. Authorization is not required. An administrative referral is needed, however, when choosing IPA's medical groups from tracking purposes and to ensure claims are paid correctly. Let's get into making a birth plan and fertility benefits. Whether it's your first child or third, you should prepare for your birthing experience. Think about your preference for labor and delivery. Canopy Health Network providers can help you make a birth plan that's right for you and your baby. Your birth plan will cover where you want to give birth, what medical options you would like during labor, and how your newborn will be cared for immediately after delivery. Canopy Health offers fertility benefits, including in vitro fertilization, IVF, which helps some couples who are trying to have a baby but have been having difficulties. Now let's talk about preparing mothers and families for healthy births. The first step toward delivering a happy, healthy baby is finding the right care partners. The Canopy Health Network includes many highly trained OBGYN and women's health physicians. The doctor you choose from our extensive network will coordinate the care of your nurses, midwives, and specialists. Choosing a birth center. You can choose to deliver your baby at any of the birth centers in the Canopy Health Network. We have birthing centers throughout the Bay Area, along with hundreds of obstetricians and specialists in high-risk pregnancy and neonatal care. As part of your birth plan, you should take a tour of the birthing center near you. Virtual tours are available at some locations as well. The Family Birth Center at Zuckerberg San Francisco General Hospital, one of your many choices for birthing centers as a member, is a welcoming place that embraces all cultures and families. Its features include allowing midwives to collaborate with obstetricians in high-risk births, welcoming doulas and other support people during birth, offering nitrous oxide and other innovative pain relief options, permitting mothers to labor actively and freely with wireless monitoring equipment, providing breastfeeding support from certified lactation consultants. Prenatal visits. Good prenatal care can help reduce or prevent a mother's and baby's illness and disability. You should start prenatal visits during the first 3 months of pregnancy. The number and frequency of visits is a shared decision between the mother and her doctor. Providers in our network. As you prepare for the birth of your child, it's important to understand all your delivery options, starting with considering what types of providers you could see. An obstetrician helps you during your pregnancy by conducting prenatal testing, performing fetal monitoring, and providing information on any physical, mental, and emotional changes you may experience. It's important that you choose an obstetrician you're comfortable with and who understands your particular needs. The Canopy Health Network has hundreds of obstetricians to choose from. Maternal fetal medicine specialists, MFM, are obstetricians who specialize in complicated or high-risk pregnancies. They are also called perinatologists. These high-risk pregnancy doctors work with mothers and babies to make sure both are safe before, during, and after birth. If you have a high-risk pregnancy, your obstetrician will most likely refer you to one. The Canopy Health Network includes some of the best MFM specialists in the country. High-risk pregnancies. If you've been told by your doctor that you have a high-risk pregnancy, that means you have one or more health concerns that raise your or your baby's chances for health problems or early preterm delivery. If you experience a high-risk pregnancy, it's important to work with your Canopy Health Network care team to get any health problems that can be managed under control and to monitor the progress of your pregnancy closely. UCSF Health was one of the country's first national centers of excellence in women's health. Whether your pregnancy is uneventful or high risk, the specialists at UCSF Health are ready to jump into action. When a mother or newborn require intensive or specialized care, exceptional physicians will help you. Parents can also rest assured knowing that they have access to a level 4 regional NICU and a neurointensive care nursery. This is where you get the highest level of care for babies. Registered nurse midwives are highly skilled experts who work with your OB in supporting you to have a normal childbirth. They monitor you for any complications and provide you with dignified care, emphasizing choices and minimizing medical interventions while keeping you and your baby safe. With the Canopy Health Network, you can choose to use a nurse midwife for your prenatal care, labor, and delivery, usually in a hospital, but possibly at home. In our network, nurse midwives and doctors work together. If your pregnancy becomes complicated, You can continue to see your nurse midwife while you also see an obstetrician or maternal fetal medicine specialist to manage any complications. You have access to childbirth classes. Many of our Alliance partners offer a variety of classes to help expecting parents and their partners learn more about pregnancy, birth, breastfeeding, and parenting. Expecting mothers can enroll in a variety of programs and classes that can help prepare you for childbirth and parenting. Postpartum visits and choosing your pediatrician. Your fully covered first postpartum visit should be 3 to 6 weeks after your delivery date. The number and frequency of visits is a shared decision between the mother and her doctor. Choose your pediatrician. Canopy Health Network has hundreds of pediatricians to choose from, each one with a unique background, personality, and approach. Your doctor may be able to make a recommendation. Take the time to find a pediatrician that shares your family values. All of our medical groups within UCSF, Marin Health, John Muir Health, Zuckerberg San Francisco General, and Dignity Health are leading providers of primary care services to infants, children, and young adults. Stay active during your pregnancy and take advantage of the gym discounts we offer. Create personalized programs to help you stay healthy during your pregnancy. Stay on top of your health with the My Canopy Health app and portal. The My Canopy Health app is a convenient way to connect to your online account. You and your family can access all things My Canopy Health. Canopy Health partners in starting a family. UCSF Health is the only nationally designated center of excellence in women's health in Northern California. The UCSF Health Women's Health Center is recognized internationally for its expertise in providing comprehensive, specialized care for women's health issues. John Muir Health helps you prepare for labor and delivery, offers pregnancy and new parent classes, and breastfeeding support. Zuckerberg San Francisco General is the only certified baby-friendly hospital in San Francisco. Resources include UCSF doctors specializing in women's health, gynecology, obstetrics, oncology, pediatrics, midwife care throughout pregnancy, labor, childbirth, postpartum, and breastfeeding support. Marin Health is Marin's only hospital resource for labor and delivery and has been delivering babies since 1952. Marin Health offers parents-to-be a range of expertise and services that make planning, delivering, and caring for your baby a personalized and exceptional experience. The Dignity Health team provides support, guidance, and specialized medical care during pregnancy. Our partners embrace diversity. For example, at UCSF Health, simple amenities like free interpreter services and multilingual menus can make your time at the birth center feel more welcoming. The Family Birth Center at Zuckerberg San Francisco General Hospital offers care in over 20 languages. UCSF Health and Dignity St. Francis consistently get high honors from the LGBT Healthcare Equality Index and welcome parents of all genders and sexual orientations. One of our most unique qualities is the Alliance Referral Program. Our unique Alliance Referral Program covers you during and after your pregnancy. With Alliance Referral, your doctor can refer you to any specialist throughout the Canopy Health Network. Our alliance includes highly trained doctors at Hill Physicians Medical Group, John Muir Physicians Network, Meritage Medical Network, Santa Clara County IPA, and Dignity Health Medical Network, Santa Cruz. Your physicians will use streamlined communication tools to share up-to-date information about your healthcare needs and treatment plan. Our alliance's experienced care managers identify at-risk members to coordinate their healthcare needs. Our dedicated care managers can personalize your healthcare and offer hands-on assistance.
Hello, my name is Adam Gunther, and I am a Senior Account Service Representative here at Blue Shield of California. In this presentation, I will be going over the programs available to you when you're thinking of starting a family. Blue Shield of California offers SFHSS qualified members pregnancy care, maternity care, and infertility treatment benefits. SFHSS Access Plus and Trio members can choose an OBGYN by asking their PCP for a referral or by accessing the Find a Doctor tool at www.blueshieldca.com and locating an OBGYN accepting new patients within their medical group. SFHSS Access Plus and Trio members also have access to the Blue Shield of California prenatal program. This program offers educational material to use before, during, and after pregnancy, such as information regarding a healthy pregnancy, postpartum care, full-term deliveries, and members also have a choice of a parenting or pregnancy book. Members can also schedule a consultation with a registered dietitian to help understand their nutritional needs before and during pregnancy, a complementary home pregnancy test, assessment at different pregnancy milestones to determine if the member needs extra support, assistance in developing a birth plan, as well as information on how to avoid a C-section, or questions to ask their provider if they are recommending a C-section, and much more. For additional information on the prenatal program or to enroll in the prenatal program, members can call 888-886-4596. SFHSS Blue Shield of California PPO Accolade members can see an OBGYN in-network or out-of-network at a higher coinsurance. Members can call Accolade at 866-336-0711 for assistance in finding an OBGYN if they haven't selected one, need assistance in selecting one, or can go to www.blueshieldca.com/network PPO to access the Find a Doctor tool to search for one on their own. Accolade engages with expectant mothers telephonically or via the member portal. The number of interactions is based on the member's needs. Accolade meets with members where they are in their pregnancy and addresses educational barriers, advocates and care needs with providers, and addresses symptoms, whether acute or chronic, at milestones that are based on their treatment plan. At-risk mothers will be identified, and a maternity registered nurse will work closely with them throughout their pregnancy. Accolade will educate the member on the importance of following up with OBGYN appointments and symptoms to watch for during their pregnancy. Upon delivery, Accolade will assess the member for postpartum depression, ongoing clinical needs, assist in setting up pediatric appointments for the new baby, and remind the member to enroll the baby in the health plan. Mom and baby are then transitioned to a care management team for continuity of care and continued support as needed. For additional information or to speak to an Accolade representative about this program, members can call 866-336-0711 or visit member.accolade.com. Blue Shield of California also offers SFHSS qualified members infertility benefits. Single women and same-sex couples would access their infertility benefits in the same manner being described. SFHSS Access Plus and Trio members would access their infertility benefits by making an appointment with their PCP and requesting a referral to a reproductive specialist. Members can request multiple referrals within their medical group if they are not happy with the initial reproductive specialist referral. If an Access Plus or Trio member would like a second opinion to a reproductive specialist outside their medical group, the member would call the 800 number on the back of their ID card for assistance. Access Plus and Trio members are allowed one second opinion, one per diagnosis in each calendar year. SFHSS Blue Shield of California PPO Accolade members would access their infertility benefits by choosing an in-network reproductive specialist or out-of-network at a higher coinsurance and making an appointment. No referral is needed. If the member would like a second opinion, they would simply search for another reproductive specialist at www.blueshieldca.com/network PPO and make an appointment, or call Accolade at 866-336-0711 for assistance. For additional information on infertility benefits or for a full listing of your infertility benefits, Access Plus, Trio, and Blue Shield of California PPO Accolade members can call the 800 number on the back of their ID card or visit www.blueshieldca.com/SFHSS. Need help finding a reproductive specialist? SFHSS Access Plus and Trio members will need to contact their PCP and be referred to a reproductive specialist. Blue Shield of California PPO Accolade members can use the Blue Shield Find a Doctor tool at www.blueshieldca.com/network PPO to search for a reproductive specialist, or call Accolade at 866-336-0711 for assistance. If using the Blue Shield Find a Doctor tool, members can narrow their search by gender and language by using the filter and sort feature after they've completed their search by name and specialty. If SFHSS members need assistance in using the Find a Doctor tool, they can watch a quick video tutorial at www.blueshieldca.com/watch Find a Doctor. Thank you for your time, and feel free to visit www.blueshieldca.com/SFHSS for more information on the offered SFHSS benefit plans and discount benefit programs with Blue Shield of California.
Hello and welcome. You're at the beginning of an incredible journey. And as you prepare to welcome your new baby, Kaiser Permanente is here to give you the care and support you need for a happy, healthy pregnancy. The purpose of this presentation is to share with you what you can expect from our maternity care, infertility treatment, and your plan benefits. Are you ready to learn more? Great, let's begin. At Kaiser Permanente, our patient-centered care has high standards, and our policies for delivering care and babies are created by our own practicing physicians. You can expect us to help you prepare for your journey into parenthood. Our best-in-class maternity care helps ensure members feel empowered knowing they are in great hands. Members can request language and interpreter services before and during any visit. We'll make sure to update the member's electronic health record so care is delivered in the member's preferred language at every visit. Now let's start our journey at family planning. Whether you're planning to start a family now or in the future, we can help your dream become a reality through your fertility treatment coverage. Your fertility benefit include medical, surgery, artificial insemination, and assisted reproductive technology. Let's look at eligibility and getting started next. First, you must be a covered employee, spouse, or dependent enrolled in a Kaiser Permanente health plan through the City and County of San Francisco. Services are covered if you're on an active cycle to become pregnant. And to get started, you'll need to be referred by your primary care physician in order to receive fertility services. This benefit is available to all Kaiser Permanente members regardless of your relationship status or sexual orientation. For example, if you're a single man or woman, married, in a same-sex or heterosexual relationship, you can use this benefit to start a family. Next, let's highlight the coverage information. Your fertility benefit covers assisted reproductive technology at 2 cycles per lifetime, in which in vitro fertilization or IVF is a common procedure. Other covered services include artificial insemination and ovulation induction. Fertility services are subject to a 50% coinsurance, and cost share does not count towards the member's out-of-pocket maximum. For detailed information, please see the plan's evidence of coverage document. Now let's highlight our third-party fertility solutions. At the Kaiser Permanente Centers for Reproductive Health, we're dedicated to supporting all our patients in their journey to grow their family. We're here to help you along the way with third-party fertility solutions at our clinics in the San Francisco Bay Area and Sacramento. Treatment may require a sperm donor, an egg donor, and/or a gestational carrier. This treatment may also involve the transfer of eggs from one female partner to another. As applicable, one of our coordinators will work with you to conduct all the necessary donor and surrogacy screenings. Next, let's look at the next phase of our journey, what you can expect when you're expecting. To welcome a healthy baby, it's important to plan a healthy pregnancy. Lots of changes, challenges, and milestones will happen along the way, and we're here to support you at every step. As you work with your care team, you can create a birth plan, which gives you a chance to think about your options and share them with your provider. Some of the options that you can consider are environment, labor, coping with pain, type of delivery, and your postpartum care. We offer many resources to help you and your partner prepare ahead. Expecting parents can trust that at Kaiser Permanente, the support continues after birth to ensure you and your baby have a healthy start to life. Your Kaiser Permanente plan offers comprehensive coverage at a copay. In addition, preventive, prenatal, and postpartum care is covered at 100%. Prenatal care includes exams, ultrasounds, lab work, and office visits. Whereas breastfeeding support, breast pumps, well child visits, and most immunizations are offered as postpartum services and newborn care. Labor and delivery is considered hospitalization services. Knowing what your plan covers and the financial responsibility will be important to avoid any surprises when the big day arrives. Now let's look at your team of providers. Because everyone's journey is unique, your prenatal care team is there to provide you with the birth experience you want. Our team of doctors have designed our programs to ensure our mothers and babies get the right personalized care. Your care team consists of obstetricians, midwives, and lactation consultants, just to name a few. If you're high risk, you'll see a perinatologist who specializes in complicated pregnancies. Learning that your pregnancy is high risk can be scary, but many of our high risk moms-to-be have healthy pregnancies and healthy babies. And if your baby needs extra care, our highly trained neonatal intensive care teams provide specialized care for newborns with unique needs. Any specialty prenatal care you may need will be built into your maternity care plan, providing you with peace of mind. If you need a second opinion, you can choose from one of the following options. You can ask your plan physician to help you arrange for one. You can also choose another plan physician and contact the appointment center to schedule a visit. And lastly, you can find a physician outside of the network. However, this will only be covered by your health plan if it is pre-authorized by the Kaiser Permanente medical group. Along with specialty care, our expecting parents have access to additional classes and resources, which we'll highlight next. Something that makes Kaiser Permanente different is our health education classes and support groups. A few of the pregnancy classes we offer are preparing for childbirth, prenatal yoga, breastfeeding support, as well as screening and support for postpartum depression. To learn more about the classes we offer at your local facility, visit kp.org/classes. In addition to our classes, our members can get helpful information from digital support. For example, you can take a virtual tour of one of our labor and delivery centers at kp.org/maternity. Or learn more about our fertility services and centers for reproductive health by visiting kpivf.com. Thank you for your time and attention. By watching this presentation, you have learned about our fertility services and what's covered, what to expect from our care team when you're expecting, and some of the tools and resources available at Kaiser Permanente to help you on this beautiful journey. We look forward to providing you and your growing family with the care that you deserve. May you live well, be well, and thrive.
I would like to thank everyone for taking the time to learn more about your maternity support benefits being offered by your employer. So let's get started. So why are maternity support benefits important? Well, first, think about this. On average, the first year medical costs for a preterm baby is 12 times the amount of those for full-term infants. Premature birth affects almost 11% of babies covered by employer health plans. Medical costs for a preterm infant during the first year are typically $54,000 compared to $4,300 for a healthy, full-term infant. Preterm infants spend on average 14.8 days in the hospital during their first year compared to 2.2 days for full-term infants. Preterm infants also need more outpatient visits and prescriptions. Now, maternity support also provides personalized support for clinical, behavioral, and other holistic care needs, including language-specific services. Designed around employees' unique health needs, the program goal is to help reduce costs related to pregnancy complications and medically unnecessary intervention. This is done through pre-engagement and risk assessment in early pregnancy, guidance to United Health premium providers, multi-model channels that include phone access, and the United Healthcare Healthy Pregnancy app to help employees enroll and engage with the program and their support team. Ongoing pregnancy Delivery and postpartum support include high-risk pregnancy support and OB home care services, regular communications designed to provide education and guidance. So how is all this done? Well, maternity support coordinates the maternity experience to maximize the use of the employee's benefits package. An employee's nurse provides personalized continuity of care, utilizing specialty resources when needed. OB nurses conduct inbound or outbound calls to engage and enroll employees and address the employee's concerns, gather the employee's medical history, lifestyle behaviors, and current pregnancy status, provide delivery consulting, initiate high-risk care plan, provide education and support for both the mother and her partner, facilitate referrals into alliance programs and community resources. If an individual is identified as at or high risk, the employee's OB nurse manages her case to communicate care strategies, ensure compliance with their physician's care plan, assesses progress, initiates interventions and referrals, provides ongoing phone-based support depending on the employee's needs and preferences. If needed, a referral will be made for additional care. Current referral channels to identify pregnant women include provider notification, claims data, referrals from health assessment, referrals from state eligibility files, self-enrollment. Maternal risk assessments are used to stratify members who have a condition that may impact their pregnancies. And high-risk case management criteria include, but are not limited to, condition history, other current medical conditions, current pregnancy conditions. 2 weeks after an individual's expected delivery date, an OB nurse begins to outreach, collect information on the outcome of the delivery and birth, provide postpartum and newborn care education, assesses for postpartum depression, provide support for the mother. Employees with no further issues or questions will be discharged from the program 6 weeks after postpartum. Those with ongoing medical conditions or issues are referred to an appropriate program for ongoing management, education, and support. Employees may call their OB nurse anytime to ask postpartum or newborn care questions. Maternity support can also help lower maternal and newborn costs, which may help reduce medically unnecessary C-sections and early elective deliveries, decrease spontaneous preterm labor risk, and better manage other pregnancy-related complications. This is designed to help deliver cost savings from avoided NICU admissions, reduced length of stay in NICU due to lower acuity of NICU infants, reduce antepartum inpatient admissions, and ER visits. Also included in your benefits is infertility treatment. Infertility services are covered by your health plan. This slide lists some of the services covered by your health plan. For more information on infertility treatment benefits, please see your summary plan description or SPD. Your health plan covers 50% of the billed contracted amount after you meet your annual deductible. Please note that you may be balance billed for non-network services. Now let's talk a little bit about the Healthy Pregnancy app. Maternity support includes real-time pregnancy app that helps deliver personalized content to determine risks and facilitate needed support and care during pregnancy. The simple, easy-to-use app helps employees to take multiple health assessments to determine risks, connect in real time with a nurse 24/7, share real-time data with nurses to support high-risk care, receive easy access to health plan resources and information, stay informed about doctor's appointments, receive customized messages and reminders to help drive decisions and promote dialogue with her doctors and care team, check pregnancy-related systems, track weight and milestones throughout the pregnancy, access informative articles on pregnancy and postpartum topics, access personalized content for gestational diabetes, record baby's development, create a birth plan to help the baby's arrival. The Healthy Pregnancy app is available for download from the App Store or the Google Play Store. Here we have an example of maternity support in action. A 36-year-old pregnant employee enrolled in maternity support at 24 weeks. Here we can see a sample of coordination of the maternity experience to maximize the use of your employee benefit packages. Intervention, right provider, right care, right medication, right lifestyle, and the outcome. After delivering a full-term healthy baby boy, both mother and baby were discharged home together within 48 hours. Materials are provided to promote maternity support to employees with flyers, posters, emails. Once enrolled, employees receive a welcome kit and other educational materials, complimentary choice of a pregnancy or newborn care book, pregnancy tips to help keep mother and baby healthy. Nurses provide education and support resources on infants and self-care for up to 6 weeks postpartum. Information provided on education, screening for postpartum depression using the Edinburgh Postnatal Depression Scale or EPDS screening tool, return to work planning, return to exercise after delivery. Here we have a real member experience of Ava. The member's name and some details were changed to protect the member's privacy. Ava has had multiple miscarriages. 2 of them were ectopic pregnancies, which resulted in the removal of both of her fallopian tubes. Ava enrolled in the Fertility Solutions to get infertility support and guidance. Through the FS program, Ava received treatment at a Centers of Excellence facility. She became pregnant after 1 round of vitro fertilization. Ava was referred to maternity support to work with a dedicated maternity nurse throughout her pregnancy. They reviewed her health story, including a history of asthma. She doesn't smoke, but her husband does. The nurse educated Ava on the dangers of secondhand smoke during pregnancy, and because of her asthma, she also stressed the importance of attending all prenatal visits and adhering to her obstetrician's recommendations. Described the adverse signs and symptoms to watch for. Told her when to call her doctor both during pregnancy and postpartum. On her doctor's recommendation, Ava began to receive care from maternal fetal medicine specialist who has advanced training and experience in care of high-risk pregnancies. The nurse helped Ava identify simple ways to improve her health. She began eating more fruits and vegetables and increased the amount of water she drank. To improve her energy, Ava began taking 30-minute walks every day. Ava delivered a full-term healthy baby by C-section. Her maternity support nurse checked in with Ava again a few weeks after her baby's arrival, and both are doing well. Thank you all for attending today's presentation on maternity support.
Hello, I'm Carrie Bashirs, the Wellbeing Manager with the San Francisco Health Service System. I'm going to spend a few minutes highlighting some of the resources that are available when starting a family or adding to your existing family. In 2017, SFHSS recognized the importance for supporting our members to establish a family. Therefore, we also established an adoption and surrogacy assistance plan. Under this plan, the city will offer a one-time benefit reimbursement of up to $15,000 to any employee or retiree who is eligible for qualified expenses incurred under the connection with either an adoption or eligible surrogacy. For more information, you can go to our website at sfhss.org/surrogacy-and-adoption. Some additional information that you'll want to be aware of is under the Department of Human Resources with the City and County of San Francisco. This includes pregnancy and parental leaves, the lactation in the workplace policy, and lactation rooms and pods. The lactation rooms and pods are available to mothers who are lactating, and they're throughout the city, where you can access those during your workday if you need to lactate. So go to the website at sfdhr.org for more information. Additionally, EAP is here for you. The 24/7 free confidential and telecounseling service is available to all city and county employees and their domestic partners and spouses. We understand that transitioning to adding new family members or starting your family for the first time can be stressful or even create some anxiety. Or even if just transitioning back to work, definitely can be challenging at times. So the 24/7 free confidential telecounseling service is here for you when you need it. For more information or just to get connected with a counselor, you'll want to call 1-800-795-2351. Thank you so much. And if you'd like some more information, you can call us at 628-652-4650.
Starting a family can be a daunting task. With so many moving parts and variables to manage, the last thing you should be worried about is navigating your health benefits. That's where we come in.
Can you stop the video? So thank you so much to all of our presenters. And now this is my favorite time, which is the live Q&A, and we have all of our presenters standing by to answer your questions. I am just going to start from the beginning here. We do appreciate and love all of the questions that you've sent in. The first question just so happens to be for HSS. I just got married. How do I sign my partner up for healthcare coverage? Also, how soon can they get covered? We're doing infertility treatment this month. Wonderful. First, congratulations, and thank you, Sonali, for answering the question in advance. So you have 30 days from getting married to enroll your spouse. Just go into the San Francisco employee portal and follow the steps to add a dependent there. Again, you'll probably need to provide your marriage certificate as evidence of you just got married. And so congratulations, and we can't wait for you to have your partner join or have your spouse join the family. Is this webinar being recorded? Yes, it is, and we will post the link on the calendar invite where you were able to join the event. We'll also be adding the videos there. And thank you, Holly, for sharing our open enrollment website. It is sfhss.org/OE2022. Next question is, I am specifically wondering which options include coverage for birthing centers, not hospitals. That is such a good question. I'm not even sure what the difference between those are. Would somebody from HealthNet or Canopy Care like to start it off? Pooja, is this a question for you?
We'd have to go back and check the specific provider benefits, but you can find that online. So there, I can tell you, I don't know in that specific area, but I know that HealthNet does cover birthing centers across California. So I would just encourage you to go and look at what providers are covered.
Well, thank you. And actually, just for a little education, could you explain what is the difference between a birthing center versus a hospital?
Yeah, a birthing center is out of the hospital, so it's usually run by midwives. And they usually have a relationship with the hospital. So in case there's any complications that come up, they can go directly to the hospital. And they have also a relationship with physicians where they can do that. But generally, it works. It's a great place of care for people with low risk pregnancies and again, usually staffed by midwives. And so people usually have very nice birth experiences there.
Thank you so much for sharing that. And Kaiser, could you help answer that question as well? Paulo?
Yes, I'm here. Can you hear me?
Yeah.
So I was doing a little bit of research on the evidence of coverage during the presentation. We do cover deliveries at the Kaiser Permanente hospitals. I wasn't able to find anything about birthing centers. However, if it is an emergency and you can't make it to a Kaiser Permanente hospital in time, you are covered to deliver your baby at any location, well, at any hospital or center. But the birthing plan and the planning must occur to have the delivery at Kaiser Permanente as expected. But if something goes wrong or it's an emergency, you are covered to deliver the baby somewhere else.
Great, thanks so much. And I believe we have Adam and Kelly from Blue Shield joining us today. They are joining by phone, so unfortunately we can't show their video. Adam, were you able to hear that question? Or Kelly, I'm not sure who will be answering.
Yeah, can you hear me, Jessica?
I can.
Okay, yes, members can go on to our Find a Doctor, and when they look under facilities, one of the options they can choose is birthing centers. So we do have birthing centers, and they would just go online to the Find a Doctor. Again, look under facilities, and when you search for type of facility, you would search for a birthing center, and it will show you any in-network birthing centers in your area or in your IPA.
Great, thanks so much. And Heather, for United Healthcare, or is that Heather who will be answering the question?
Hi, Heather's here. Yes, it would be the same for United Healthcare. Through our search for a provider in a facility, they would certainly just search under the facilities for birthing centers and locate in-network options.
Jessica, can I? Yeah, sorry, can I actually was able to find which birth center we cover in the San Francisco area, and it's called San Francisco Birth, and that is covered.
Excellent, thank you so much. And it just so happens the next question is for Canopy Health and HealthNet. Is Canopy Healthcare Plan an option, or is this part of any of our plans? So the answer is yes, it is. Pooja, do you want to explain how it works?
Actually, that might be a better one for Andrea to take. Andrea, do you want to take that one?
Sure. So can you just repeat the second part of the question? I didn't quite catch it.
Oh, the member was asking if Canopy Health is one of their healthcare options, and we're happy to say that it is. And is this part of any of our plans?
So I think the second part of the question is the plan piece is HealthNet and Canopy have partnered to form this package of benefits. So when you think of plan, in Canopy's case, it would be HealthNet providing part of this partnership and Canopy providing the physical doctors, nurses, and hospitals that coordinate and provide care.
Thank you. And I think the next question might be a continuation from the prior question because the member asked, does this plan cover IVF for single mothers by choice?
If that question is directed to Canopy, yes, absolutely.
Thank you. And will this presentation include information about Kaiser? Yes, we did just share information about Kaiser earlier. Thank you for that. Is Highland Hospital and Birth Center in the network with Canopy Health HMO?
Yes, it is. Highland is part of our network.
Okay, excellent. And now the next question is for Kaiser. I'm with Kaiser right now with my, right now, my understanding is that they do not provide any options outside of giving birth at a Kaiser hospital. Paula, would you like to take that? I know you sort of answered that earlier.
Yes, that is a true statement, Jessica. Like I said before, though, if it is an emergency and the member is not able to get to a Kaiser hospital in time to deliver the baby, they are covered to go outside of KP.
Great, thank you so much. And the next question, I think it is for UHC and Blue Shield. How much of infertility benefits are covered? Is United Healthcare PPO no longer available? And Heather, thank you for answering that earlier. UHC's PPO plan is available only to dependents of UHC Medicare Advantage members, effective next year, January 1st of 2022. However, we do have the Blue Shield of California PPO accolade that's available to you. Adam, could you elaborate on that a little more and their infertility benefits?
Sure. What we did is Blue Shield mirrored the current UHC benefits. So the infertility benefits that you were having under United Healthcare are going to be the same benefits you would have if you chose the Blue Shield PPO Accolade plan. And the coverage in the PPO, the Access Plus, and the Trio are all 50%.
Thank you. And I think this.
Yeah, if you want additional information on what is covered under the benefit, the best place to go is onto the microsite, and you can pull up the summary, and you can see what's in there, the IVF and all that stuff, and everything's covered at 50%.
Thank you, Adam. And I believe this next question is for you as well. It says, it looks like under the new PPO plan, which I assume is the Blue Shield of California PPO Accolade plan, we have less infertility coverage. Why the change? Actually, I do not believe that is true. Adam, could you elaborate on the infertility coverage?
Yeah, again, it's exactly what was under United. So it's the same coverage that you would have had had the plan stayed under United. So it's nothing, it's not less than what you had before. It's exactly the same.
Thank you. And the next question is, will you please summarize how much each plan covers for infertility treatments? Actually, across the board, we cover about 50% for infertility treatments. Paulo, do you want to start that off? I know the cost, the actual hard costs probably differ from provider to provider.
Yes, so the average cost, and I'll put a link in that person's post, but the average cost can range anywhere from 10 to 20,000 depending on the treatment and the drugs and the services that were provided. But the member responsibility will be a 50% co-insurance, so 50% of that total cost.
Thank you so much. And HealthNet or Canopy Care, do you have an idea of costs for IVF?
The cost would depend on the individual's kinds of benefits she needs. It's always 50%. So for example, if it is routine delivery, that doesn't apply. If it's say IVF, for example, if someone needs IVF once, that's going to be one cost. If they happen to need it twice, which is covered in this package, that would, that doubles the cost and responsibility of the member. It's twice the amount of service. So it's always 50% of what's medically necessary and what's needed.
Thank you so much. And
Jessica?
Yes?
Yeah, this is Adam. I wanted to also add for Blue Shield, if someone's going to access infertility benefits, we strongly encourage, and it's very important, that the members stay in network for that 50% contracted rate. If the member does go outside of the network, it's still 50%, but the provider can balance bill the member because they do not have a contract with Blue Shield and therefore do not have to accept our 50% as payment in full. So want to make sure that the members understand that distinction, that we want you to stay in network where the costs are controlled at 50%. But if you do want to go out of network, it's still a 50% benefit, but that provider may charge you the difference between the 50% and what they actually billed. And they have the right to do that because they're not under contract.
That's a really good tip. Thank you for bringing that up, Adam.
Absolutely.
And the next question, what are the benefits offered, if any, for surrogacy or adoption for gay couples looking to start a family? That's such a great question. Carrie, do you want to take that or do you want me to? Yeah, sorry, Carrie Bashirs.
Yeah, sorry about that, Jessica. You can take that, that's fine.
Great. So I believe our coverage for adoption is $15,000. You actually don't go through any of the health plans. You would go through HSS for that. And Sonali, do you have more details about how someone could apply for that?
Sorry, what's the question again? I'm sorry, Jessica.
The adoption benefits. I believe we cover $15,000 for adoption, but how would someone apply for that?
Okay, so they send in all their paperwork and then it gets reviewed by the legal department, and then we contact the member regarding if they qualify or not. So it starts with the paperwork, and I can look into that more, and I can circle back to this member.
Okay, great.
If they call, so have this member call HSS and we can help out.
Okay, wonderful. Yes, please call our member services, and that number will be shared in a few slides. So thank you so much for asking that great question.
Jessica, this is Holly, moderating as well. We can also link to our SFHSS surrogacy and adoption page plan on our website.
Okay,
So
that'd be great.
I'll post that in the chat too.
Thank you so much. And I know we have 5 minutes left, so I'm going to see how many more questions we can get through. Can you share their link of the third-party cycle? So I saw that Paulo from KP had shared their link. If HealthNet and Blue Shield can also, and UHC can share those links, that would be great. Do you know the average cost for pregnancy at each plan and the C-section rates? So Paulo, thank you for answering that first for Kaiser Permanente. The cost share for hospitalization, labor, and delivery on the Kaiser Permanente plan is $100 copayment per admission. HealthNet or Canopy Care, what do you have your rate for hospitalization and C-sections?
The only thing the member would need to be concerned with is their copayment, not the contracted rate between the plan and the hospital. The only thing that any employee would be responsible for is that small copay.
Great, thank you so much. And do you know the average cost range for IVF? The member would like to set aside funds in an HSS, maybe they also meant FSA account. HealthNet, could you take that question first? Pooja, I'm sorry.
Can you repeat the question, please?
Yes, so do you know the average cost for IVF treatment? The member wants to set aside funds in an HSA, perhaps their spouse has an HSA account, or they have their FSA with us.
Oh, you know, that is so specific to the provider that you end up choosing, and there's such a big range for that I think it's best to just check with the provider that you choose, because just depending on the type of practice or the, you know, whether it's private or part of the university, there can be quite a range. So I would say usually 15,000 per cycle, 10 to 15,000 per cycle is a good range to consider.
Thank you.
There is a cost estimator on the Canopy Health website that helps members figure out these kinds of things. So when looking around for things for which there is a variable cost, the cost estimator on our website can be helpful.
Thank you, Andrea. And for Blue Shield, Access Plus, and Trio, can members go to CPMC on Van Ness or California Street? Adam, could you answer that?
Yes, they can on both.
Thank you. Can you post those links or can they be sent out? I'm not sure which links those are in reference to, but we will share links to this webinar, as well as you can find resources on our open enrollment website at sfhss.org/OE 2022. Can I set a one-on-one consultation for IVF for Blue Shield, and how? Adam, do you want to answer that?
Yeah, you can, but that's really something, because it's so complex and involved, that we'd want to get you in contact with someone who could assist you better than the person who would be taking the consultation. I don't know, Jessica, if you can get their information, maybe I can have someone reach out to them directly and talk with them.
Yes, so they are showing up as anonymous. So we do recommend, if you do have a question, you can certainly start with a one-on-one consultation with Blue Shield, and you can get that appointment. Actually, can we forward to that slide, Brian? Thank you. Oh, yes, and we do have our raffle drawing. I think it was the other slide about setting up a one-on-one consultation with our health plans. And as Brian's finding that slide, I did see a few questions, so I'm just going to combine them so we can help our members. Which plans cover midwives and doulas? There was another question about that. So Andrea, could you share if Canopy Care covers midwives and doula services?
Canopy definitely covers midwives. I believe at this time we are not covering doulas. Our hospitals do allow doulas to come in and be part of the experience, but at this time, doulas are not a covered benefit.
Thank you. And Blue Shield?
Can I just add though? Oh, I would just add though that we're exploring that as a future coverage, and it's looking likely that we will cover it in the future.
Excellent. Thank you so much, Pooja. And
yeah, great addition.
Thank you. And Adam, does Blue Shield cover doula or midwife services?
We do cover midwives. Let me double check on doulas and I can get you the information because I'm not sure. I want to say yes, but I want to get you the correct information. But midwives, yes, for sure.
Great. And I know we are ready at time at 1 p.m. So I thank you, Brian, for finding this slide. This is how, if you go to this website, you will be able to schedule one-on-one appointments and ask any question that we weren't able to answer today. I do want to thank everyone for coming. Could you share the raffle prize page? And Sonali or Holly, if you could share the raffle link, that would be great. We want to thank you for attending today's webinar, and we have awesome raffle prizes that all of our vendors have provided. So, and we definitely want to give them away. So please fill out the form. Let us know that you attended this webinar so that we can choose a winner from the drawing, for the drawing. And finally, if you have additional questions or if it's related to your account, please reach out to our member services. They are here to help. And we look forward to you making your elections for this open enrollment. Thank you so much for attending.